I don't know how there was any way to get through all those questions.
You know, one thing to think about, I don't know if this makes it worse, and I know people are probably sending you stuff all the time, but if we get stuff in advance, maybe we can try to power through questions. I don't know, just to try to hit them proactively.
Yeah. 1 second. Let me see how I can get this.
I can hear you guys. Okay.
Oh gosh.
All right, welcome everybody. Sorry, we're just transitioning over. We'll get started in 1 second. Or we can see your presentation slides.
My secret notes. Oh no.
Secret notes. All right, welcome. Thank you for those of you that switched over. Those of you that were just joining us, my name is Corinne Waldo. I'm the hi. I got some highs on the Q&A already. I'm the Senior Director for Economic Vitality at the Boulder Chamber. Thank you for joining us for this week's retail call. Sorry for joining a little late. We had a lot of questions and a lot of people on the previous call. This is a retail specific guidance. We did have some changes this week and they will go into effect on Friday. And for retail, that is actually a positive change, but we do want to review the guidance and not just capacity limits, the guidance for retail this week with you. Please put your questions in the Q&A. We will reserve the chat for resources, for links. We're going to use that to provide you material, and that we're going to use the Q&A for you to provide us questions. At this time, I'm going to hand it over to Jesse. Take it away.
Thanks, Corinne, and thanks everybody for joining us. I will jump right in. Oh, excuse me. So I'm not going to go over the epidemiological information. I feel like we talked about it at the last session, and really I want to focus on the details for retail. But suffice to say that currently we are under level 3 high risk orange, whatever the name for it, I believe it is still orange now. But as of Friday at 5 p.m., we will be moving to a new level, which is called severe risk. It's the new red. Just quickly, want to go over this information, the dial information. These are our 3 metrics that we need to meet. And right now we are at almost 760 cases per 100,000 in Boulder County, and that's much the same throughout the entire metro region. Our 2-week testing positivity rate is up at 8.3. That continues to rise slowly, but it's not a great metric for us right now. Our hospitalization status, we are still at 11 days of decreasing or stable admissions to the hospital. So that is a good sign. So quick change. Right now, again, we are under orange. I'm starting with occupancy limits for orange, and I'll talk about red as well. So, sorry, this red is from the previous red. So excuse me for that mistake. So occupancy limits, you are at 25% of posted occupancy now. Under the new red, please ignore what's written here. You are at 50% occupancy. So you actually go up under this new, the new phase we will be entering on Friday at 5 p.m. And curbside pickup is encouraged though. That is still part of red. So now, switching just to the guidance. This is not occupancy. This is just our guidance for operations. So curbside pickup is encouraged. Providing dedicated in-store hours for high-risk customers still encouraged. Restricting your return policies to items that can be sanitized is really important. Implementing contactless payment, and remember, masks are required for both employees and patrons. That mask order is still in effect. It's still reflected in the public health order. Masks are required. In terms of other practices, encouraging and enforcing 6-foot distancing when possible, using the stickers on the ground, X's, tape, whatever it is, to try to encourage people to spread out. Establishing one-way traffic flow through aisles is important. If if you've got a high traffic flow establishment, and this is a requirement, installing protective plexiglass shields at checkout counters. This is something that I think for a while a lot of critical retail were not doing. And I want to remind everyone, this is for all retail, critical, non-critical, doesn't matter. You need to have protective plexiglass or shields at your checkout counters to protect your checkout personnel. So in terms of employees, you need to be doing daily symptom checks, keeping track of that. The guidance recommends having a person per shift who's sort of in charge of making sure that everyone has their symptom checks and that all that information is being recorded and kept. So providing appropriate PPE to employees. This is really important. We need to protect the folks who are working on the floor. And also, requiring employees to stay home when they're showing any symptoms or signs of sickness. This is actually something that's come up with a couple businesses, not so much retail, but some of our other business types. A reminder, you are required as an employer. You are required by the order to exclude employees who test positive or have symptoms. That is a requirement under the public health order. This is the new Boulder County Public Health Order that came out last week. It is really mostly overridden by the existing or by the new order that's coming out on Friday. But I just wanted to remind you that the public health order, this public health order remains in effect through December 14th. If we go back to orange, this will still be in effect. And any place where this is stricter than the state guidance would still be in effect. But in terms of retail, there really isn't anything here that really affects your business. So in terms of severe risk, this is the new red. On the 20th, which is Friday at 5 p.m., we'll be moving. I said likely because I wrote this last night and we hadn't been told for sure, but we are definitely moving on Friday at 5 p.m. to the severe risk level. Critical and non-critical retail may operate at 50% of capacity. So this is just a great way to make up for the mistake I made earlier where I didn't change the red level language. 50% of capacity. But it does encourage curbside pickup, online orders, that sort of thing, to try to reduce the number of people in your stores. Critical business. There are a number of critical retail providers, and I just want to remind you, you must follow sector guidance for capacity and other requirements, unless doing so would make it impossible to carry out critical functions. That includes your employees who are sick or had close contact. They need to quarantine in the case of those who've had close contact with someone who tests positive, or they need to isolate in the case of those who are positive. And look at that. A little bit of sick employee versus outbreak guidance here. A single sick employee does not make an outbreak. That's 2 employees or more, and we will work with you in those situations. If you have 2 employees who are sick who test positive within 14 days of one another, you do need to close for the day, and we will work with you to try to figure out how to reestablish operations as quickly as possible. And this is just more background information. An employee who's considered positive has tested positive for COVID-19, not just someone who has symptoms. Someone who has symptoms does need to quarantine for 14 days, but they have not tested positive until they go and get a test and they get their results back. And a close contact is someone who has been around a person who has tested positive for more than 15 minutes in a work shift or 24 hours. And this is something that comes up all the time, and Lane does a really good job of explaining this. A contact of a contact is not a contact. You do not need to quarantine if someone was in contact with someone who was in contact with a positive person. So it's sort of degrees of separation. If you are a first order contact, you need to quarantine. Anybody else, second order contact and beyond, you do not need to quarantine. Lane, you do so much of a better job than I do with that.
And I gave the example last week. My son,
right.
I got a call. I got the call last Friday that he was exposed at school. He had to go into 14-day quarantine. I'm sticking him in his room. He's using a separate bathroom. He walks around with a mask. I'm not in quarantine. He's in quarantine as long as we maintain his distance. And that's the example of, like, as long as he's really quarantining, you know, I am not the one in quarantine because I wasn't exposed.
See, real life example. Thank you, Corinne.
I'm using it, and I'm telling you, on the last call, people asked about my son, but I'm using that and I'm making him quarantine because I don't want to.
No, fair enough. This is, again, going back to that critical business, essential employee question. There is no shortened quarantine at this time for essential employees. That's a local level decision. The one caveat for that is at hospitals. Hospital workers and first responders do have slightly different guidance. But again, this shouldn't affect retail. For retail, even critical retail, you do not have shortened quarantine. 14 days. And then this is just my pleading with everyone. Please require masks, follow the state guidance, wash hands, socially distance, encourage employees to do all of that. And the limiting group gatherings at work, I know it's easy for people to get near each other. I've heard from a couple of retailers who have even started installing plexiglass in their break rooms to try to limit interactions between employees. It seems drastic, but it's also, you know, that's a place where you're going to get a lot of people hanging out together. And I also just want to encourage, you know, we hear a lot about employees who get together outside of work. That's a very dangerous situation. It's not allowed anymore as of Friday under the orders, but please encourage your employees. I don't want to say encourage your employees to stay away from each other, but outside of work, they really can't be gathering.
Can we stop there and give an example? Like,
yeah,
you're at work, you're working so hard to maintain, you know, the 6 feet, wear masks, you know, making sure your workforce is able to come to work every single day. And then they go out after work and they have a social gathering or have a beer and they're within 3 feet and they're taking off their masks and they're socializing and they're letting down the guard and then they get exposed and then everybody on your workforce is quarantining.
Yep.
And that's when we forget that that's how easily that the virus spreads, and it's that social interaction, and it's that time when we're at home and we're inviting people over and we don't wearing the masks and we're within 6 feet. That's how it's spreading, and that's why our numbers are going from 300 to, you know, a couple weeks ago to 800 now.
And we've seen just a huge increase in business outbreak investigation work. And the staff that are doing that are finding a lot of Halloween parties where coworkers were all at the same party. They all got sick. And so it's triggering it to be an outbreak at the business. And likely the exposure was the social interactions of the employees outside of work. So you don't obviously police that, but it does then come back to impact the business because now you have multiple employees that are sick at the same time. And it has impacts to your staffing ability and all sorts of stuff. But we're seeing a huge amount of spread from social gatherings.
Yeah. Thanks, Wayne. I'm still talking. I thought we were at questions already. Sorry. Whew.
Sorry, we interrupted you today.
That's okay. No, I appreciate it. So planning, this is sort of, you know, there's no guidance in anything from the state about this, although they did just release Thanksgiving guidance, but I'm pretty sure that's just about please don't gather. But what I want to encourage everyone to do is start thinking about the next 3, 4, all the way to the end of the year weeks. We are getting close to the end of the year. That's sort of crazy to me, but we really need to look at ways to reduce crowding in stores. Appointment-based shopping is something that some businesses have looked into. Extending sales. I was talking to a business today that had basically took their Black Friday sales and they just said it's the entire month of November is our Black Friday sales. Online shopping and curbside pickup, they've been encouraged from the beginning. I really do want to encourage that. And I think, Corinne and the chamber they provide these great opportunities to have conversations about this. And I think I encourage you all as business owners to start talking together about what are ways that we can reduce the number of people in a store and still allow for local shopping. We want to drive people to do their shopping locally, but we want to do it safely. And so just really want to encourage that conversation, and we can have that here. That's sort of why I was so adamant about having this conversation today, to the detriment of all the people in the last call who wanted to ask more and more questions. I feel like our retail community really has a big hill to climb here, and we want to help as much as we can. So my last couple slides are sort of standard. The exposure notification system, please sign up for it if you can. We've heard about bugs, we've heard about issues. Those are all going to get worked out over time. Obviously, the more people that sign up, the better. And it is a living, breathing, changing thing. As more people sign up, it becomes more effective. It also may expose bugs that need to be fixed and things like that. But that's an ongoing effort. I did see that 1 million people have signed up for Colorado's exposure notification system, so that's great. And just reminding everyone, we have our weekly updates, and then this Friday, I really do need to start putting these on the slide. This Friday at 11, we have another general session. We'll go over the guidance updates for this new red level, and then take lots of questions. And then there's also a Spanish language session. They record it in advance. They don't take questions, but it's got all the same information, and the Latino Chamber runs that, and it's really a good tool. And then finally, if you have questions, please don't hesitate to email us. Happy to take them. And with that,
all right, you've confused some people.
Great.
Yep.
Sorry.
I thought I had to be at 25% capacity. What are you talking about? I can be at 50% capacity,
Exactly.
Jesse.
But you can't be at 50 until Friday at 5 p.m. for reasons that are not clear. I think, Corinne, you gave an explanation last time in our last session of why this changed. So if you...
So I think a lot of people on this call weren't on the previous call. And originally, when we were going to move to the red level, which is now the second to last level, not the last level, which is now the purple level. So if you want to go back to, do you have the new
I don't have the new dial.
Oh, that's too bad. So the new dial has used to be the old red level had retail closed, and you would just be able to do curbside. When they went and revised the new stay at home, they had created a red and then a purple. The red, when they started to look at how transmission was happening, it was happening these personal contacts, these close contacts for more than 15 minutes. And they did a little bit more of a surgical approach, and retail was decided that based on national data, that they would, as long as you continue to follow the orders, use everything that Jesse mentioned, continue to, do the plexiglass, single way traffic, temperature, all the stuff you're supposed to be doing, that they would continue to allow retail to operate, and they increased the capacity levels to 50%. And that is at orange and red as of Friday at 5. So yes, as of right now, you can be at 25% capacity, but as of Friday, you can be at 50% capacity, and that's for critical and non-critical. So the next question was about bike retail and whether or not that's classified under critical, which currently the maintenance is only under there, but actually there is no difference between critical and non-critical retail capacities in this order at this time, unless we move to purple.
Right.
I hope that answers. Oh, I got to thank you. Apparently that answered the question. So, so currently you're at a lower capacity. This is the one industry that saw an increase on Friday, which I think this is the only time we've been able to deliver good news in the last. That and personal services don't have to close on Friday.
Mm-hmm.
Well, I think overall it is better than the alternative that most things were going to be closed if the state hadn't made some of these changes. So, so overall, even though many sectors are still decreasing, this is the only sector that actually is increasing. So it's the only one that has, the most positive news.
Yeah, it is. You're increasing. You're able to stay open, especially around these holiday times. And we're heading into the holiday. Your season that this is where most a lot of retail happens for the year. And what we would have considered the red in the past would probably be the purple in the future. And that would be that curbside only. They do recommend as much curbside as possible. So the question is about curbside. They do recommend as much curbside as possible and to continue to provide at-risk and senior hours for those, because there is still a need for additional times for people that shouldn't be out and about in the community. Are there different requirements for non-critical retail once we hit red on Friday versus critical retail?
No, they're the same.
Capacity,
really at all levels. So it's very interesting that sector has really no changes across all of the new dial levels.
Mm-hmm. So that kind of eliminates some of the. So our thrift stores included in this 50% capacity on Friday. So thrift stores are considered a retail. And so they can maintain that 50%. I know a bunch of thrift stores were trying to see if they could see if they could fall under that critical retail. At this point, unless we were to go into purple, there's no differentiation between the two at this point. Yep. So there's a question. Somebody used my son as an example. So at this time, again, he's 14, so I can put him in the basement. I can quarantine him. I can separate him. He's not 4, so I can do this. But if he were to test positive, at that point, I would have to quarantine because I have a direct personal contact to somebody that tested positive. So the question is, if he were to test positive, at that point, I would have to quarantine. So that that relation of a relation, at that point, that's when it affects me.
Well, the caveat would be if you've been within 6 feet for more than 15 minutes over a 24-hour period. If you have not, then you are not a high-risk exposure. So it is possible to quarantine someone and not have the rest of the people be high-risk exposures. In fact, that's the goal.
So that has been my goal. I will say I love my son, but we've been talking via text and masks and stuff. So, all right. Any other questions? Oh, so question is, will we be posting the video of the cross-industry session? Because people missed that one. And the answer is yes. I promised I would send that one out as soon as possible because people want to get that information. So as soon as it uploads, I'll try to get that out tonight. If not tomorrow morning, I might have to get it out in the morning. So.
And I just was going to mention, I've posted a few different links in the chat to the order itself, which has all the narrative, which includes a lot of information, but I also did a summary chart that shows all the different levels of the dial by sector. But again, you're going to see for retail, whether it's critical or not. It's 50% capacity at all levels until we get to purple.
Okay. So Jesse, what about offices within retail? I mean, there are some rather large retailers in our town. How do their offices need to operate?
So your office spaces need to operate as offices, which means they need to be at 10% of their posted occupancy. So that's your fire code capacity, 10% of that.
Even if I have 7 offices with individual rooms, and this is an actual question from a retailer.
Yeah. Even if you have individual office, your office space is the larger building or larger part of a building that your office is in, and that whole area needs to be managed as a single office, and it needs to have an overall capacity. So it's kind of it is a lot to do with how a building is constructed. In most cases, if you have an office that's in a larger structure, if you have an office complex, basically, the room capacity includes all of those individual one-person offices. That it's considered part of one larger room, even though it has 4 walls and a door from a fire code perspective. So that's how that comes about. An individual's office within a larger office complex is treated the same as a desk. Okay. And we do not have good words for this. It's hard to explain.
But... Okay, so I'm a critical retailer. Does that automatically mean my office is critical office?
No. Again, if so, a critical office function needs to be listed in the critical office functions. Just providing office services to a critical manufacturer, critical whatever, does not qualify you necessarily as critical. And again, even if it does, you should be trying to maintain parity with other offices. So reaching down to that 10% capacity.
And within that office, you're trying to provide the minimum basic operations within your office with it, those things that can't be done at home.
Right.
So if you have to run payroll in the office, then that might be that 10% that comes in. Right. If you can't do that, it has to be within the secure office environment, or that, and then the portal. The only exceptions are those industries where there has to be physical presence, like defense. Those might be those ones that fall within that critical office. But right now, just because you're a critical retailer doesn't mean you have unlimited office coming in.
Exactly.
Well, this one's kind of challenging. There's no sort of such definition of critical office. So it's critical business, and whatever your critical business is, now you're not differentiating the different capacities of the loading dock versus the waiting room versus the office versus the bathrooms. It's a critical business, and you need to follow as much as you can the sector specific guidance, unless again, it's impossible for you to carry out that critical function. So there aren't as many set capacities, but you should be looking at those. If you can have all of your people work remotely, then you should do that. So those are the kind of caveats, but there is no list of critical offices. It's critical businesses. So if it's a pharmacy that has office space, a pharmacy is considered critical, and they should just limit where they can. Again, there's no critical office. You're not going to find that as a listing of who are the critical offices. That's not how it's structured.
And so many questions about this today. That's why I keep asking this question, because I think there's that minimum basic operation. There's just a lot of questions about it. What if your business occupies several levels or floors of a building?
So it sort of depends. You need to look at your fire code, how your fire code is written. It should be written per floor. And so it would be that floor space that would define that.
Yeah, again, I really refer people back to the order, which is one of the links I posted, and look at Appendix A, and that's going to tell you what you need to do and whether you're listed as a critical business or not. Again,
and I think this is more along the lines of office occupancy. If you're looking at the office occupancy, because it's now reverted back to of your posted occupancy. In this case, if you're looking at that floor occupancy, each floor occupancy, didn't matter though if you could close the door between everybody. If your floor occupancy is 8 people and everybody could close their door, 10% of that 8 people is, well, less than a person, but you get my drift there, even if you could close your door between all of those.
And I think, yeah, it's really important to note that the closing the door thing, the 4 walls and a door thing, really only has an impact when it comes to, can I take a mask off? But again, focusing, I think it's really important to also focus on the fact that the order does encourage, and I think Lane, you and Corinne have both said this, if you can work from home, if you can send people to work from home, please do. It's just a really good way to keep them safe and keep others safe.
Okay, any other questions out there? I know that, we've oft, there were a couple times though, I want to point out, there were a couple times we had some good news a couple weeks ago for one of our industries. And then the very next week, you got a lot of complaints in that industry. And I think the caveat here is let's make sure that we continue to, require masks, single way traffic, use the plexiglass, you do the announcements, follow the protocol, because you don't want to see an increase in complaints against retail the moment we go to red. And that's one of the reasons you wanted to have the call today, was to make sure we're sharing best practices. Everybody knows what they need to do so that we can continue to see retail at a higher capacity than what was supposed to be at. Will the space calculator be updated, or do we use 50% of the space do we use the space calculator?
Excuse me, no, so your capacity for retail is the fire code capacity for your space, for your building, for your establishment. Sorry. Stumbling over words here. Yes. So your 50% capacity is your fire code, 50% of your fire code capacity.
And that includes staffing, because it's spacing. It's not limited, it's not 50%, and it's spacing includes people. And if you have a lot of like aisles and furniture in there, you might have to be a little bit more conservative on that, correct?
Yes. Yep. Yeah.
The space calculator certainly is a good tool that might show you a much more realistic number of people to allow in. I think 50% of the building occupancy fire code capacity in some cases can still present challenges to overcrowding, especially in a retail setting where you're not able to fully control who's going down which aisle at which time and things like that. So this definitely can lead to complaints. We see, especially larger stores have chronic problems with checkout and areas where you start to see now bottlenecks of people by potentially allowing too many folks in.
All right. Are there any other questions for our retailers on the call? This is like the opposite of the last one, where I'm like, I can't keep up. All right. Well, if you do have questions, I will send out the recording for this one. I'll send out the recording for the previous call, which goes through all the sectors. And remember that we do have a Friday at 11 o'clock call that will go through the change to red, which takes effect at 5 o'clock on Friday. So you're in orange at 25% capacity until 5 o'clock on Friday, in which case you go to 50% capacity, which at that point we're we're in the new level, and I think it's all up to all of us to continue to speak to our employees, to our customers, to everybody, that it's all up to all of us to bring those numbers down. We will be in this level for a while until we can get our numbers down as a community, until we can show progress, until we can get everything going in the right direction as Boulder County and as the region, and we stop the spread of this virus. So again, Friday, 11 o'clock, if you have more questions. In the meantime, please feel free to email the email address on the screen. If you only have my email address, you know that I try to get back to you as quickly as possible. If it's a resource, I send it to you. If it's an interpretation, I don't tend to do that. I tend to send it off to Jesse or one of the other, or to covidbiz@bouldercounty.org. Stay safe, stay healthy, and we'll see you next week or Friday at 11. Well, actually, next week is the week before Thanksgiving. We're going to decide what we're going to do for that call. If nothing changes, we might take a week off calls.
Ooh.
I haven't told you guys that yet, but we might take a week off. I don't know. Well, hopefully nothing changes.
What am I going to do with my Wednesday afternoon?
Yeah.
I don't know how to fill time without these.
Well, you're only allowed to have Thanksgiving with the people under your household, so you'll be making dinner with your family. So everybody, we'll see you on Friday. Bye.
Thanks, everyone. Thanks, Corinne. Thanks, Lane.